It's a lot of work, and the pictures that we saw, they add context. A lot of feelings have started, but this is good news, because if we start having feelings like that, we need to contain them somehow. Tatiana said that Lisova Polyana have prepared 16 specialists using narrative exposure method. This is what we're going to speak about with the masters in psychotherapy specialist from Constance, Eva Barnevitz.
Time. We know that we took 15 minutes of your time. Hopefully you got your 30 minutes and you are not restrained with the time. And now we are all ears. The floor is yours.
Thank you so much for your invitation. I hope you all can hear me and hear the translator perfectly fine. Thank you also for all translators working in the background and for the technical support. It's a great honor for me to be here today, and I want to thank everyone who made this possible. Amongst those who are collaborating here, Xenia, we've seen you on stage already, Tanya as well. Marina, special thanks goes to you as well in all the organizations before this meeting, and as well the NGO Bluebird and the NATO Fund. Thank you all so much for making this possible. My name is Eva Barnevitz. You know this already. I'm a clinical psychologist and expert for trauma therapy, especially narrative exposure therapy. And I would love to share with you today some of the findings that we had in a training that we provided for Ukrainian specialists between, I believe it was January 2022 and the beginning of 2023. So I'll share my screen with you, and for the technical support, in case it's not visible well, please let me know. Yeah, so I would love to share with you the main points of this training and also introduce a little bit about narrative exposure therapy, which is a beautiful and valid and just great tool to overcome the speechless terror that war and captivity pose upon people. So just some general information on the project. It was a cooperation between many stakeholders. The State Institution Hospital for the War Veterans Forest Glade, which many of you know, the NGO Bluebird, the Ministry of Health, the Ministry of Defense and Ministry of Veterans, as well as the NGO Vivo International, which is the organization which trained me and my co-trainer Charlotte Salman in this approach to trauma therapy. And then of course also the NATO Support and Procurement Agency. Thank you again for making this possible. The aim of the project was to train 16 mental health service providers to provide narrative exposure therapy to survivors and civilians of conflict-related trauma. The main goal originally was just on narrative exposure therapy, but throughout the training it expanded. So I will share with you a list of the main contents. The main focus was on narrative exposure therapy, which includes using diagnostic tools, providing psychoeducation, and then helping people overcome their trauma. Before we dive into the contents of the training, I would like to share with you why we decided to work with narrative exposure therapy and why it's such a wonderful approach. Narrative exposure therapy is an approach to trauma therapy that has been developed specifically for contexts of low resources or scarce resources, especially for contexts of war and trauma, and especially for survivors of multiple traumatization. So exactly what we see in captivity, in war, and similar settings. It focuses on the scientific findings about trauma. So the slide that I'm sharing with you right now, there's too much information on it to go through it in detail, but I'll be happy to share these slides with you after this conference. When we experience a traumatic situation, our bodies and brains react in very specific ways. So what you see here is the cascade progression that we go through immediately in the moment when a traumatic situation is happening. So at first we freeze, we have this brief moment. When we hear a loud sound, for example, we breathe, we stop breathing, we have big eyes, big ears, we try to orient ourselves. Then next we have this sympathetic arousal. We go into fight or flight mode. And if this doesn't help us to escape the situation, we will freeze. We will not move anymore, but we will still see and hear and sense everything that's happening in the situation. If there's still a chance for escape, we will escape. But if we cannot escape, then we will go into the state of flag, where the parasympathetic nervous system is highly aroused. And in the end, we will faint. Explaining this to survivors of traumatic situations, especially sexual violence, where people usually would go into this fright state where they just freeze and they cannot move anymore. And also explaining the neurobiological basics of what is happening during a situation like this to survivors and also to their family members normalizes the symptoms. And this helps tremendously in overcoming the stigma of trauma and also in healing from the trauma. The other main part that narrative exposure therapy is based upon is the so-called fear network. You can see here an example of the memory network of a person that has experienced a number of events. So I will not go through everything by itself, but just to walk you through it step by step. What you can see always in the boxes is the so-called cold information. Where did it happen and when did it happen? You all have experiences in your lives, both positive and negative, where you know exactly where did it happen and when did it happen. If this was an important moment in your life, you will also remember everything else that would usually be called our memories. So you can remember the sensory information that was present in that moment, which you can see here in these round shapes. You can also remember the emotions that were present in that moment, as well as the thoughts and your physical feelings or your physical perceptions, like a fast heartbeat, a churning stomach, sweaty hands, things like this. If you look at this network here, this has formed for a person who has survived a number of events. Now, the big problem that we have here is that in our brain, when these areas are activated or these individual parts of our memory, we can only activate one place and a time at once. So then what happens is the cold memory gets lost, and what remains is just a network of fear memories and so-called hot memory. And this is exactly what the previous speaker referred to, which is why some people who have survived captivity cannot stay in an enclosed room. Because if the doors are closed or if I hear the sound of a key, my entire network will ignite. And this explains all the symptoms of post-traumatic stress disorder. The intrusions, the memories that are suddenly overcoming me, the avoidance of persons not wanting to talk about it at all, this feeling of nobody can understand me, the social withdrawal, and then also the hyperarousal where people have sleep problems and they get angry very easily. All of these symptoms can be explained because or due to the fear network and this cascade that I just shared with you here of our fear reactions when we are alarmed by a traumatic stressor. You're really getting the basics of NET here in a very brief and very quick version. Feel free to reach out to me if you have further questions about it. But I want to keep it very brief because I want to focus on what did we do in the training. However, there's one more slide I want to share with you about the basics of it, which is the building block effect. And this is a piece of information that is very important. What this slide shows you is the more types of traumatic events a person experiences, the higher is the probability of them developing PTSD. And we find this building block effect in numerous studies conducted worldwide. I've studied at the University of Constance in Germany, and that's also where I have worked for a number of years at the Center of Excellence for Psychotraumatology. And my main job was to provide trauma therapy to victims of torture. And that's one of the groups only where we find this. We also find it in survivors of sexual violence. We also find this building block effect in former child soldiers. We also find this building block effect in patients that have been diagnosed with a borderline disorder, in children, in adults, across cultures and countries. Taking all of these findings into account, what we need to do in trauma therapy is not only focus on one event of a person's life, but on their entire life. And to figure out which ones are the most important, most distressing events in their lives, and then help them work through that, so that we can reintegrate their experiences into their biography. A lot of clients say, you know, I just would like to forget. And I think one of the previous speakers also said this. We cannot help them forget it, what happened. But what we can do is to help them sort the pieces of the puzzle so that a coherent picture can be seen again. Just another slide to show you what happens due to traumatic stress. The depressive symptoms go up, the functional impairment goes up, and then also the physical complaints of persons go up the higher the traumatic load is. And we see something very similar, and then I will not bore you with research findings anymore. The same thing we find for people who have or who are working in emergencies as medical services. And again and again and again, we find this building block effect. So what we did in this training, the training that we provided had been planned for a really long time. I think the first time I shared emails with Tanya and Marina was probably in 2017 or 2018. And what we provided were 3 training phases that you can see here in June, in August, and December 2022. And then until April 2023, we provided supervision. There was a part that was mandatory supervision, and then there was also supervision that people could just attend if they wanted to. So the basis of the training was really just to provide the basic knowledge of narrative exposure therapy, focusing on diagnostics and psychoeducation, and then practicing the lifeline and the exposure sessions. In the exposure sessions, what we do is we really dive into the memory network of one event and talk through it in detail so that the memory can be reconstructed and reintegrated. And this is what helps the symptoms to go down. In the second phase, we did a review, of course, because there was some time in between June and August. And then we also focused on shame and dissociation and guilt and how to work with that, because these comorbid topics are so important when we are working with survivors of captivity and victims of torture. Shame puts such a barrier between people. When I feel ashamed, I leave the human contact. I cover my face, I cover myself as much as I can. But with that, I cannot go into a good contact that I would need in therapy with my client or the client with a therapist. So this is a big topic that we need to address. Then later on, we also talked about planning therapy and a lot of additional topics, which I will share with you now. So throughout the training, what we found was that due to the situation in the Ukraine, just focusing on narrative exposure therapy would not have been enough. So what we needed to do was to expand the training to also focus on depression and suicidality. Tanya mentioned that a lot of veterans suffer from suicidal thoughts, and a lot of them are actually committing suicide because they do not get the help that they need. We also needed to focus on psychological first aid due to the situation that a lot of clients would come to their therapist just right after a strike and just right after they experienced something traumatic. We also added motivational interviewing in order to help the participants of the training build therapy motivation in their clients, because narrative exposure therapy is a pretty tough approach, both for clients and therapists, but it's helpful. It's as if you're getting the root canal treatment from your dentist. You only want to do it if you really need it, but you also know for sure that it's going to help you get through the pain and feel better afterwards. The training also entailed a skills training and also, which is so important, self-care. And self-care a lot of times is sort of seen as the luxury, but really it's burnout prevention and prevention of secondary trauma, which is something that a lot of trauma therapists need because we are a risk group for developing PTSD ourselves. And only if we take good care of ourselves, we are able to help the people directly affected in the long run. So what exactly do we do when we're doing narrative exposure therapy? It's a treatment for survivors of repeated or continuous traumatic stress who suffer from post-traumatic stress disorder. And it's designed to heal the injury of domestic and/or organized violence, including war trauma. It can be used both for victims and perpetrators. And it's an evidence-based treatment. And this is something that I really want to stress here. A lot of approaches to trauma therapy mean well, but they're not evidence-based. So let's always take a look at, is there the evidence that this is going to work? Because we must not do harm. This is the rule number one. It can be conducted with adults, adolescents, and children above the age of 7. And it helps to overcome and prevent traumatic stress. It helps safeguarding the rights and the dignity of people affected by violence and conflict. What we do with the clients is we chronologically reconstruct all important life events. We have a full activation during the exposure sessions of the worst moments of their experiences so that this fear networks that I shared with you earlier can be reorganized into separate moments in their autobiography, and it's not all mingled and mixed up. What also comes along with this is the cognitive re-evaluation of what happened. A lot of survivors have irrational thoughts about what happened. They have thoughts such as, I should have done this differently. If I only had done this, all of this wouldn't have happened. It's my fault that this happened to me. And they have this delusion sometimes almost that only if they had acted differently, maybe their friends would still be alive, or their family members would still be alive, and not take into account all the factors that contributed to the situation. Another really important part of this therapy is that survivors of traumatic events a lot of times feel very isolated and very alone. And that's why I call this presentation Overcoming the Speechless Terror. A lot of people do not even know how to put words to what they've gone through because it's so unbelievable and it's so difficult to say it out loud what happened that I'm afraid I may go insane once I speak about it and nobody will be able to listen to this. However, in narrative exposure therapy, that is exactly what we're doing. We are breaking the power of the perpetrators by putting words to what happened. And as a therapist, I'm witnessing and guiding my client through this experience of putting words to it and empowering them to be the author of their own life story. And this comes along with a huge acknowledgement of the survivors' human rights and supporting them in regaining their dignity. As the person is sharing their story with me, which I am structuring so they don't go into dissociation, but I'm structuring it and helping them put together the pieces of what happened when and where and what they thought and what they felt in their bodies and what emotions were present. While I'm helping them do this, I'm also writing down that story. And in the following session, I will reread the story to the client and then continue with the next story. Now, these stories that I'm writing down during the therapy, they can serve as testimonies I will hand them over to the client in the last session, and they will decide what they want to do with that. And this has such a healing power and sometimes it's almost like a holy moment when I'm handing over this document to the client and we're all signing it. The client, me, the translators who might be present. I've mentioned this before, but I want to stress it again. Narrative exposure therapy is a culturally sensitive approach. It's evidence-based. It has a focus on therapy, on the human rights, and it's low threshold. It's very easy, so to speak, to learn this approach to trauma therapy because it's very clearly structured. And this is why this training that we did was also possible to be conducted online. So I will share with you a little bit more, just one more piece of information about the narrative exposure therapy. So you have a full picture. The length of the sessions, it's 90 to 120 minutes. This can be very challenging in different clinical contexts because time is limited. However, we only need 6 to 12 sessions for each client. So if you think about this, you invest 6 times 90 to 120 minutes, and the PTSD symptoms will go down immensely. Not necessarily immediately during the treatment, because the brain needs time to rewire. But in the course of the months after the treatment, the PTSD symptoms will drop immensely and they will stay down. The follow-up studies that we have conducted worldwide show that up to 2 years after the treatment, the PTSD symptoms will still be below threshold. And for more than 2 years after a treatment, it's quite difficult to find the clients. So this is just an example from NET versus randomized control trial in Rwanda, where, as you know, a lot of people have also been heavily traumatized. And what we can see here for the NET groups, for the treatment groups, is that the guilt score goes down, the depression score goes down, and also the PTSD score goes down. Whereas for the group that was on the waiting list, the symptoms barely changed and certainly didn't change significantly. So again, coming back to the training that we conducted, it happened between June 2022 and January 2023. The supervision sessions continued. The participants attended between 5 and 26 supervision sessions, which in the beginning, we were really doubtful whether supervision would be helpful, because given the context and given that people have so many more topics on their plate during a war, we said we still need to offer it because we need to ensure that what we provided in the training will be used in the way that it was intended to be used. Looking at the attendance and how many sessions we were able to provide and the topics that I have listed here for you, just a selection of topics, we could see that the supervision was such an important part of the training. A lot of trainings that are conducted really just give the training and then that's it. And I'm so grateful that for this training, we could provide supervision for 7 months. What you don't see on this slide is that there's a Telegram group where the people are still connected and where they still communicate and where people can still reach out if they have questions. The results of the trainings was that 16 mental health service providers are now able to provide narrative exposure therapy. Immediately after the training, 15 out of the 16 already were able to provide narrative exposure therapy to survivors of traumatic war events and captivity. And the supervision was not only accepted, but highly appreciated and ensured the high quality of the provided services far beyond narrative exposure therapy. We also talked about acute suicidality. We also talked about building trust, which is something that is so challenging with people who have experienced the worst parts of humanity. The challenges, as you can imagine, providing a training in narrative exposure therapy, which also includes a lot of self-reflection and going through your own traumatic events to conduct this online was quite challenging. There was, of course, the repeated delay due to numerous reasons, including the events of February 24th. It was originally planned as an in-person training. And then, of course, during these online trainings, we had power cuts. There was a high level of uncertainty regarding the safety of the participants. We didn't know if all participants would be able to show up the following day for the training. We didn't know if even maybe during the training there would be an air alarm or any incidents happening. We were very fortunate that all participants survived and that all participants were able to stay present. And then, of course, the participants themselves were going through traumatic situations, witnessing things that were happening, experiencing dislocation themselves. There was a high stress load for the participants. The key learnings, number one, we were really happy the training in narrative exposure therapy can be done online via Zoom. Of course, also other platforms if you wish. Training specialists in the Ukraine to work with victims of torture and war-related violence, even during this intense phase of the war, was both necessary and beneficial, not only for the participants, but of course, mainly for their clients. Providing the continuous supervision afterwards facilitated the group cohesion and the sense of mutual support. And this is such an important factor in supporting therapists in their mental health and hence avoiding burnout and secondary trauma. And then, of course, the supervision also helped to ensure the high quality therapy because new challenges would arise and we could always provide the information that was needed. These are just some notes from the Telegram group that I screenshotted this morning, which I think show you that the participants really appreciated not only the training, but also what was done beyond the training. And again, I want to say thank you. I want to say thank you to everybody who's listening right now. I want to say thank you to everybody who helped put together this training, who supported it financially and organizationally. I want to say thank you to all the translators, some of whom are present here today as well, and also the technical support. And then, of course, also the participants of the training. They were some really brave people, and they are dedicated to supporting each other, to supporting their clients, and to supporting this fight that you are all fighting right now. And then, of course, I also want to say thank you to all the clients who are brave enough to face their past and come back fully to the present moment. Thank you so much for inviting me. And I think we have still a few moments for questions if there are any.